Hi there. My name is Dr. Jazz. It's a pleasure to meet you. I will be your caregiver for today. Is there anything in particular that might be bothering you? Okay. So it seems like you have on your report here some tingle immunity, and you also reported some insomnia as well from your last doctor's checkup. Is that correct? Okay. Perfect. And how bad would you rate this insomnia on a scale of 1 through 10? Okay, so that does seem pretty high up on the scale. Let's go ahead and take a look at that. What we do here at this clinic is just help you relieve some of that insomnia and tingle immunity that you are experiencing. So we'll be running through a few tests today to ensure that we get this problem fully fixed for you, okay? Great. I just wanted to ask before I begin, do I have consent to touch you, your face, maybe a little bit on your shoulders, or just when we do the stethoscope? Okay, perfect. So, just gonna start here. Okay. Tingle immunity is a very common problem, and one of the most common fixes I have found is the doctor checkup. Most patients actually find this to be extremely relaxing, and we can start with that as well to see if you may have any other deficiencies, okay? Great. So, let's start by checking your heartbeat. I have the stethoscope here. It might be a little bit cold when I put it on your chest. Go ahead and just move your shirt just a little bit. I'm going to be pressing this right up onto your chest. It's a little bit cold, yeah. I want you to just take a deep breath in, okay? Go ahead. And exhale. Good. One more time here. Take a deep breath in. I'm just gonna move your shirt around a little bit. Okay. Deep breath in. And out. Good. Okay. I am also noticing on your report that you do have some vitamin deficiencies. Okay. Are you familiar with which vitamins you might need? Okay. Let me take a look on your report here. Okay. So, Care of, which is the brand that provides these vitamins for us today, has a blend of all the vitamins you would need to take in a day. So if you are a little bit forgetful like I am, this is perfect. I personally also love this brand. It has my name on it. It says, "Hi Jasmine." And it has a little tip or a quote on each packet. This one says, "Trust dogs. They always know who to stay away from." When we curate yours, it will have your name on it, of course. So here we have Calcium Plus for bone health, astaxanthin for skin and eye health. We have cranberry for urinary tract health, 2 multivitamins to cover your nutrient gaps, rhodiola for stress and mood. I believe this helps with the afternoon crash that you might feel during the day. A probiotic blend and 1 vitamin C for immunity health. Oh, and probiotic is just really good for your gut and immunity health. You'll have all of your vitamins in one place, and Care of makes it super easy for you to take your vitamins and actually remember to take them. So you can just easily dispense one out when you need to take your vitamins. If for any reason you feel like your results are not accurate, just head to careof.com and fill out their quiz so you can find something that works for you. You can click the link in the description and use code ASMRJazz to get 50% off your first order with Care of. Big thank you to Care of for providing us these supplements. Now, you can go ahead and take these, and when you're done, compost the packet after. Alright, next we'll be doing a little bit of face pressing. I am seeing some areas on your face that might be of concern. Tell me, have you had any injuries recently? Could be on the top of your head here. It could be anywhere on your jaw. Just let me know if any areas feel sensitive, okay? Yeah. Okay. So you said that you may have had a little injury on the top of your head. Left side or right? Okay, good. Okay. I'm going to touch the other side now and let me know if that is causing you any discomfort at all, okay? No? Okay, good. Near the jaw. No. Other side. Okay. Gonna press along your chin. Okay, and a little bit along your forehead. Okay. Go ahead and look up. I'm going to be pressing underneath your eyes just to make sure that there are no broken capillaries or sensitivities underneath there, okay? Go ahead and look up. Just gonna check there, okay? Okay, gonna look. Okay, looks good. Gonna feel around your cheeks now. So you can go ahead and pick a spot on the wall or look at me. Doesn't matter. Just gonna press around the cheeks, okay? do in between your brows there. Okay. And over top of your eyebrows. Let's do the right side. And the left side. Excellent. Okay. Now let's do the forehead. Is there any pain whatsoever as I'm doing this? Good. No. Okay. Please do let me know if there is any pain. Okay, that's good. Let's do your chin. Working up to the cheek. Gonna massage around your nose here. We tend to carry a lot of tension and stress in that area. Can also do a little bit around your mouth as well, okay? So just go ahead and relax your face. Relax. If you're frowning, just put your mouth in a neutral position. If you're smiling, same thing. Okay, just gonna be working around the nose there, making little circles. Looks good. Okay, other side. Just make little circles like that. Okay, perfect. Now I'm going to be working around the smile line. So, this one, I want you to try smiling as big as you can. Just going to feel around first. Massage a little bit around the mouth. Okay. Now, keep that big smile on your face. I'm going to just be pushing that inwards to see how that is functioning. And the same thing with the other side. Go ahead and smile as big as you can, and I'm just going to push that inwards. Keep smiling. Perfect. Okay. Now I'm just going to be doing the top of your forehead. Just a little massage to kind of help you relax your face. Let's do the temple area. And the other side, the other temple here. Okay, that feels good. Alright. Since I did go a little bit close to the injured area, that didn't hurt at all, did it? No. Okay. Alright. Go ahead and look up. Tilt your face up. We're going to be moving on to the neck and throat exam. So, I'm gonna start off by... Sorry, I'm gonna ask you to put your face back down a little. I'm going to be looking inside your mouth first. That might be better. So, go ahead and say ah, and I'm just going to be looking inside, moving and try to lift your tongue up. Okay, good. Okay, perfect. Everything is looking good inside of the mouth. So, like we talked about earlier, go ahead and just move your face up, and I will be pressing on your neck area. Just gonna be that looks good, and here. Okay, that looks good as well. Going to be just okay, and on this side as well. Okay, perfect. Excellent. So it does look like there's nothing to be concerned about on the neck area. And once again, you didn't feel any pain as I was pressing, right? Good. You are doing an amazing job, by the way. I'm just going to record our findings on my little laptop here, just so we have it. On a scale of 1 to 10, I want you to let me know how the face pressing felt to you for tingles. Okay? Okay, perfect. Next up, let's move on to the facial sensations test. Okay. I will be putting some different textures on your face. I want you to let me know what it is you feel. Does it feel softer? Does it feel maybe a little bit more scratchy? Go ahead and close your eyes. Close them. Perfect. Going to go ahead and touch a random point on your face, okay? How's that? Yeah, soft. Good. Gonna go in again. Soft. Again. Perfect. Now, go ahead and let me know again. Keep your eyes closed. You're doing an amazing job. Okay, close your eyes. Excellent. That was scratchy. Okay. One more time. Go ahead and close your eyes. Keep them closed. And soft. Excellent. I'm going to use a different tool here. I want you to tell me if you think the surface is wood or metal, okay? Go ahead and keep your eyes closed here. Going to just go in. Wood, okay? Keep your eyes closed. Keep them closed. Keep them closed. Keep them closed. Good. Excellent. Metal. Okay. Keep your eyes closed. Metal again. Good. And one last time. Keep your eyes closed. What? Perfect. Let's go ahead and put these back. You got every single one of those, correct? You're doing such a good job. So if you had to rate that on a scale of 1 to 10, what would you give that in terms of how many tingles you got? 0 being 0, 10 being amazing, all the tingles. Okay. Okay, just unlocking my computer, sorry. There we go. Excellent. Got that recorded for you. Let's move on to your skin analysis. This is another very popular trigger that people love at this clinic. Another fan favorite. I'm going to be putting this on right here. Turning on the little light and looking closely at your face there. Okay. We are checking now for any moles on your skin that could potentially pose a threat or a risk to your health. Okay, let's see here. Okay, nothing there. Nothing there. Good. Up on your forehead. Good. Nothing there. This is a little bit different from the other exams that we did because this one is going much more in depth into your skin there. Okay, good. One more area right here. Okay. So it does look like your skin is free of any moles or possible threats that could damage your skin barrier. I also did not see any sunburn, so good job on wearing sunscreen regularly. Another fan favorite here is the vision test. I'm going to be asking you what color you see. So if I can open this. There we go. Going to be covering your eyes or one of your eyes with this lens. Just let me know what color or colors you see, okay? 3, 2, 1. You can describe any color you might see here. Good, yes. A little bit of red. Purple. Yes, maybe a bit of green. Excellent, maybe a bit of blue. Perfect. Moving on to your next one. Okay. Good. Yellow. Perfect. Last one. Good. So, red or orange. Either is acceptable. Okay. Perfect. You nailed that test. We'll now be moving on to the light triggers test. I want you to let me know when the light comes into frame, okay? Awesome. Go ahead and look at my nose. Just going to align myself perfectly with the other. There we go. Alright. Let me know when you see it. Perfect. 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 Keep looking at my nose here. Perfect. Good. 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 One more time. Excellent. Okay. I'm going to be taking this little light here, and I want you to tell me when you see this little flashing light, okay? Okay. I'm going to be looking inside your eye. Good. Keep focusing on this one here. Perfect. Good. 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 Okay. One more time on this side. Good. 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 Very good. Okay. Follow the light. So, follow the light. I'm just going to be looking right at your eyes. Follow the light. Follow the light. Follow the light. Okay. Excellent. Keep following the light. Okay. Now I want you to pick a spot on the wall. You can look at this plant here or this candle here, and do not get distracted by the light, okay? Okay, good. Good. Good job. Amazing job. Okay, we're going to be measuring the distance between your eyes with this little device here. What this does is it helps with finding your prescription or correcting your prescription. So go ahead and look straight ahead at me. I'm just gonna get centered with you. Look straight at my nose. Okay, and I'm just going to place this gently over top of your nose. I'm going to be looking at each eye there. Okay, so it looks like this one goes from 40 to 30. Just and this one goes from between that 30 to 25 to about 35. Okay, excellent. one last test with the light here. I'm going to be holding this right up, and I want you to tell me when you see the light, okay? Good. Good. Very good. 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 Okay. That wasn't too bad, was it? Yeah. Okay. I'm going to draw a shape on here, and I just want you to tell me what shape I drew. I'll do that again. Ready? Good. Triangle. Here. Square. Yeah. Let's do. That might be a little lopsided. I'll do it again. That was a very bad circle. And last but not least, let's do star. Excellent. Okay. Moving on, we will be looking inside your eyes, but for the last trigger, I'm curious, on a scale of 1 to 10, did you get any tingles, or how did you feel about that trigger? Okay, I'm just gonna go ahead and write that down. Very good. Okay. There we go. Next up, let's move on to looking inside of your eye. So, going to just make your eyes a little bit bigger, extend them like this, stretch them up and down, and look carefully inside the eye. Okay? Sorry, I should have warned you earlier. Bit of a bright light. And this eye here, okay, go ahead and relax. Bright light coming in. Good, okay. Gonna stretch the eye up. Gonna stretch the eye down. Okay. Stretch the eye up. Down. Good. Okay. I think it's also important for us to get something out of your eye. Now, most people don't actually have something in their eyes, but we will be checking because you can never be too sure if an eyelash fell in or if you might have something there. I'm going to be grabbing this little Q-tip, pulling the eye down, just stretching it down like that. Okay, and this eye, let's take a look. Okay, let's see here. There we go. Okay. Okay, going to be looking around your eye. Don't worry, we're not putting this big thing in your eye. Just to feel feel? Okay, that looks good. Just going to be tracing that around the eye like that. That concludes our vision test. Next, I will be doing a scalp exam on you. I would say that this would be our most popular trigger, as a lot of people find it quite relaxing and nostalgic. So, I'm gonna be looking first through your scalp there. Okay, just bringing the light around the edges of the scalp, maybe near the forehead. Okay. Just going to be looking like so at the scalp, making sure there are no nits, which are little lice eggs, laying anywhere near the scalp. Okay, going to be taking a closer look by your ears, because that's usually where nits love to lay their eggs the most. It's the most common area they're found. So, just gonna look closely there. Closely at the ear to make sure that there's no nits or anything like that there. Excellent. And on this side as well, let's go ahead and take a look near the ear. Okay, everything's looking good. Okay, not seeing anything concerning there. So all of our vision and touch related tests are done. We're going to be moving on to your other senses, as those can also give you tingles as well. So I'm going to be whispering some words in your ears, and I want you to repeat them back to me, okay? Excellent. Let's start with this ear here. Plethora. 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 Excellent. Tranquility. 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 Good. Good, good, good. Delicacy. Delicacy. Good. Serendipity. 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 Good. Elixir. 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 Okay, one more word. Galactic. Galactic. Good job. You got all of them correct. Excellent work. I'm just going to record that down on my laptop once again. Okay. We can do some inaudible whispers as well. How did you feel about those? Okay. Moving on, we can do a bit of a smell test. Test your olfactory bulbs, I believe. I have these papers here and a few spray bottles which has different scents in them. I want you to tell me what you smell, okay? Okay, ready for the first one? Go ahead and take a whiff. Vanilla. Excellent. Let's do your next one. Cinnamon, very good. Let's do another one. Good. Forest pine, excellent. Okay, I'm going to record that down. And let me know if that last trigger gave you any tingles. It could have been from the sound of the spray bottle, from the visuals, or from the scent. Excellent. Alright, next up is the taste test. I'm going to be putting a drop or two of very specific tastes on your tongue. Okay, go ahead and tell me what that tastes like. Yes, mint. Excellent. Let's do your next one. Okay, ready? Okay. What did that taste like? Sweet. Yeah, very good. You don't have to get specific with these. You can just let me know if it's sweet, salty, spicy as well, okay? Excellent. Next one. Going to okay. And what did that taste like? Salty. Yes. Okay. Last one. Last one. Good. Spicy. Okay. So that concludes our taste test. I think we have gotten through all of our exams for today. We can now start curating your Tingle prescription. I did record your responses for the other tests. How did you feel about this test? Okay. Let me just write that down. Okay. So, all of your results are right here on my laptop. I'm going to be combining all of your favorite triggers into this little bottle right here and give that to you to help with your tingle immunity. So, we will be making one pill together. So let's go ahead and remove the cap. Going to be adding in a few drops of the taste that you liked. There we go. A bit of this for the tingles. There you go. We can add in a sprinkle of our special tingle powder. Should be good. It smells like watermelon. Take our little spatula. We don't need too much, just maybe about that much should do. There, we got a little bit at the bottom. Okay, now let's go ahead and reassemble this here. There we go. There's your little tingle prescription. Going to put that inside your bottle, and I will get my assistant to finish the rest. Put your little label on it with the directions. Like that, and just stick it on. Go ahead and press that label on. And there you are. There is your tingle prescription all done and perfectly curated to you. The directions say to take when whenever you need it. You can't really overdose on tingles, I promise. Anyways, that is for you. And since this is our first few trial runs, you will be getting this for free. If you need a refill, just feel free to come on in at any time and we will happily provide you with some more. Thank you so much for your participation. We will send you a copy of your results very soon. And we hope you enjoyed your time with us.